It was really hard knowing that you couldn't send most of your employees home, that they had to show up to work every day, and that, you had the responsibility not only to them, which was obviously critically important, but if you weren't able to do it in an effective way, you could affect the delivery of critical supplies into the hospitals.
That's Mike Kaufmann, former CEO of Cardinal Health, and I'm Josh Nelson, head of healthcare at THL Partners. And this is Healthcare in Action. It's a podcast that explores the latest developments and innovations transforming the U.S. healthcare sector, from cutting-edge technology to thoughtful approaches to patient care. I'm here with my colleague, Jon Lange, who will lead us in a conversation with Mike about the drug distribution landscape in the United States, as well as the challenges and lessons learned from leading a Fortune 15 healthcare company. Jon, take it away.
Thanks, Josh. Today we'll be looking at a critical part of the U.S. healthcare system that all of us rely on, but is often taken for granted: healthcare distribution. Behind every hospital, pharmacy, doctor's office, and home delivery is a system ensuring that medicines and supplies arrive where and when they're needed. It's the backbone of modern care, and companies like Cardinal Health make it possible. In this episode, I spoke with Mike Kaufmann, the former CEO of Cardinal Health and a 30-year veteran of the company. During his tenure, the company reimagined the business model of drug distribution, navigated global supply chain disruptions during COVID, and grew into one of the world's largest healthcare services companies with more than 50,000 employees worldwide. Mike has been a real thought leader in modernizing healthcare distribution, and he was one of the key architects who created the current distribution business model as we know it today. I was so pleased to speak with Mike about the history of Cardinal, how consolidation, competition, and innovation have shaped the sector, and leadership lessons from navigating COVID and other crises while staying laser focused on the vitally important job of getting life-saving products into the hands of providers and patients. So let's get into it. Mike, thanks so much for joining me today.
Well, thanks for having me. Always enjoy talking to you and the team, and hopefully some of the insights and stories I share today will be helpful.
Maybe to start, a lot of people will know of Cardinal Health and will know about drug distribution, but there is such a range of businesses and such an interesting history. Can you just set the stage a bit? What does Cardinal Health do? And maybe give a little bit of background on the market landscape.
Sure, absolutely. So Cardinal's healthcare services company, really, again, focused totally on healthcare. The biggest businesses in terms of revenue are going to be the pharma distribution business and the medical distribution business. Those are the two biggest in terms of revenue. But Cardinal's also number one in nuclear pharmacy, number one in medical products to the home, freight management for healthcare entities. So Cardinal has more than probably 20 different companies that roll up to make the company what it is today. Many of them market leaders, and all of them at least leaders in their respective spaces.
Can you talk about the competitive dynamic as well? There are a couple of other big companies in the space. And so how did they come together? What's the nature of competition among the big three?
Yeah, there's really three large players. It would be McKesson would be the largest, and then Cencora, and then Cardinal Health. They're the big three. They're controlling over 90% of the market share of drug distribution into the various providers, whether it be retail independent, regional chains, large chains, nursing homes, hospitals, et cetera. So there's three very large players. McKesson's been around the longest and was very large when I actually joined Cardinal in 1990. And over that time, Cardinal did a lot of consolidation, as did what was AmerisourceBergen is now Cencora, and grew to be able to compete effectively with McKesson. But they're all really three great companies that really deliver a lot of value to their customers and have done a nice job of not only in drug distribution, but all of them have diversified in some unique ways that really makes them interesting companies that have done really well.
Got it. And you, of course, were at the helm during COVID, which was disruptive not only for healthcare companies, but really the whole world economy. So can you talk a bit about that? How did Cardinal and how did the market evolve during COVID? What were the key challenges?
Well, I think the first key challenge of when you're the CEO of a business or any leader of a business and you have something like that is the safety of your employees, right? And so at the time you have to remember, it's easy today 5 years later to think about COVID in one way. But at the time, there was so much unknown. And the threat of the health of your employees was significant. And so figuring out a way quickly within days to immediately get people working remote, figure out where they couldn't work remote, which would be in most of our locations, right? Because we're distributing pharmaceuticals and med surg supplies and nuclear supplies that couldn't be shut down. Those people couldn't work from home. And so we had to find a way to keep them safe every day by helping them distance and mask and all the different things that were going on at the time. So there's a lot of unknowns, at the time. But the most important thing that I was thinking about as a CEO was, how do I keep my employees safe so that they can continue to do the critical jobs that, we provided? We're one of the largest providers of PPE. And at the time, trying to find masks and gowns and gloves and getting them into particularly hospitals to treat the people that were ill was just an unbelievable task that took a lot of my time. I literally spoke to someone at the White House on a daily basis for months, understanding where the hot spots were, where we could get the product, but at the same time, always remembering, how do I keep my employees and their families safe? And that was a key.
Just put that in context for us. How many employees did you have, and what were some of the roles, on the front lines that maybe were trickiest to keep safe and get them the equipment and the PPE they needed?
Yeah. So we had about 50,000 employees in total. So as you can imagine, there's somewhere in the neighborhood of, let's say, 60 to 70 distribution centers between pharma and med that are delivering, getting orders by 9:00 at night and delivering next day to your, hospital or pharmacy. None of those could shut down. And you're trying to figure out, not only in the US where, a little less than half were operating, but also trying to figure out how to keep your employees safe in distant countries like Thailand and Costa Rica and Dominican Republic and Malta and other places where you have plants, working with those governments and those employees to make sure that those employees are safe. I think we did an excellent job of that, but I can tell you that it was very hard because we had lots of employees that passed away due to COVID in many of our plants, like as everybody did. And hearing those stories of those employees and in the impact that many of them had on their, teammates in their various plants, it was something every day that I personally took note of and wrote a personal note to every single family that lost someone that was a Cardinal employee. But it was a very proud time, but a very gut-wrenching time when you're worried about your employees.
Yeah, absolutely. And on this point, you were a leader at Cardinal for many years, and I'm sure you've been through a number of crises. But when something like COVID comes along, it's business as usual up until one day, and then the whole world changes. What do you do? What is your first step in terms of digesting that crisis and reorienting your team toward taking quick action against that crisis?
Yeah, that's a great question. And I think the first thing is you have to, especially as the CEO or any C-suite leader, right? People look to you. And if you look confused or nervous or distraught or whatever, that's not going to send a good message. So it was really important on my short drive to work every morning to make sure that, I took a breath and went in with the attitude that we're going to take care of you. We know how to do this. Trust us. We're learning as fast as we can on every piece of data that comes in around what to do that's for your safety. And so I think showing that level of both authenticity, concern, confidence, it's really important as a leader to make sure that people see that. But then they also need to hear you communicate a lot, especially during times of great distress and challenges, is people want to hear from you. They don't want you to hide. And so getting on every day and having some type of communication with employees in a periodic fashion that was as open and transparent as you could possibly be, but also being authentic and honest around what you did and didn't know. I think that was an important part of leading through, the crisis. Of course, you need to surround yourself with people that are smarter than you, that understand a lot of different things. Obviously, that's incredibly critical to get a team together and really talk about all the different avenues. But I think as the leader, it's about exuding confidence that you and the team can make sure they take care of everybody, being authentic, communicating. And I think those are really important things to keep in mind.
It's really interesting to hear you describe that, because I imagine it's quite a difficult balance where on one hand, you want to project calm and that you've got it under control and you're taking care of the situation. At the same time, I'm sure you also have some self-doubt. You haven't dealt with exactly the situation before. And as you said, you sort of have to take the time to center yourself to make sure that you can project that to your team. You have to continue to be authentic. I'm sure that's something that every leader deals with to some extent, but particularly for the leader of such, an enormous and important healthcare organization, I imagine it was just really hard.
Yeah, it was really hard knowing that you couldn't send most of your employees home, that they had to show up to work every day, and that, you had the responsibility not only to them, which was obviously critically important, but if you weren't able to do it in an effective way, you could affect the delivery of critical supplies into the hospitals, which again, at the time, not only had your normal patients, but just all of the COVID patients there and the challenges that they had for getting supplies and everything. So being part of a healthcare organization is why I stayed at Cardinal for 32 years, is that I really truly felt that what Cardinal Health does, what McKesson does, and Core does, these are all companies that matter. That on a day-to-day basis, there are people's lives that are dependent on the success of these companies to deliver what they say they can deliver, whether it's drug distribution or a nuclear test or a product to your home to help make your life better at home. It matters. And so for me, doing something that mattered always motivated me and kept me excited about being there for so long.
Really interesting. Yeah, I want to talk for a minute just about the economics of Cardinal and its peers. And so can you talk a bit about just how they make money today?
Yep.
And I know, you were really the architect of this economic model 25 years ago. And so can you talk about the economic model prior to that and then how this current model came about?
Sure. So prior to about 2005, the way that distributors made money on branded drugs was they did spec buying. So they bought ahead of price increases, and then there was a price increase, and they would sell that drug at the new price, even though they bought it at the old price. Then at Cardinal, we would, potentially buy 40 days for every 1% of expected price increase. So we could have up to 240 days was kind of our limit of inventory. A price would go up, and for the next 240 days, we wouldn't really buy much from the manufacturer, and we would sell through that inventory at the higher price. So that was a piece of our margin. And then we made the 2% cash discount. And so those were by far, more than 90% of the margins in 2005 and the way distributors went to market. So it was an interesting model in that every year you had a different set of profitability from different manufacturers. So it was hard to predict. It was lumpy. It wasn't very capital efficient, but it was the way the distributors made their money. All three made their money that way, and that's the way they did it on brand drugs. After 2005, one of the large manufacturers, Bristol Myers Squibb, it's very public data, had a lot of extra inventory in the system. The SEC came in and decided that anything more than 4 weeks of inventory in the supply chain, then the manufacturer could not actually recognize the revenue. And so overnight, the three distributor stocks crashed, and manufacturers started monitoring distributors' orders and cutting orders. So service levels got messy. Your margins on the buy side dropped dramatically. And there was a real state of turmoil at that time in the drug distribution model. So I was actually head of procurement at the time and was tasked by our CEO, what are you going to do? How are you going to change the model with pharma? And the team and I came up with the idea of a fee-for-service model where we would work with the manufacturer to determine what is the fair fee that each manufacturer should pay Cardinal for our services. And so what we did is we partnered with one of the consulting firms. In this case, it was Deloitte. And the Deloitte team and my team worked together to create a next best alternative model for every manufacturer that said, if pick one, Pfizer, Amgen, whoever, was going to handle all of their drug distribution themselves, what would it cost them on a percentage basis of their drugs? Then model two was, what if they did it with UPS or FedEx? What would that cost them? And then we looked at those, assumed they would choose the lowest cost of the two, and then we set our fee below the lower of the two so that we would always be their best alternative.
I think that's such an interesting example because one, it's data driven. You actually thought through what are the alternatives, what do our customers need, what is the value proposition we want to offer. And then the other piece I think is so interesting is because you were able to construct this economic model that was a win-win. Customers maybe weren't forced to take it, but were really incentivized to do business with you. And that has lasted and led to growth in the distributors and additional benefits of scale, and has really led to a sustainable competitive advantage. And so how did that actually go in practice, that negotiation with your customers? Because you were bringing them a new model, which hadn't been done before. And so was it smooth? Was it tricky? How did that go?
Oh, it was incredibly rocky to start. At first, the feeling was, hey, you got to rush. You got to get something. So just pick something, and just go out to the manufacturers. And as you can imagine, when I'd walk into a manufacturer, they would say, why? Why is that the right number? And my response was, because it helps me replace my earnings. And I knew that was a bad reason and it wasn't going to work well. And it didn't. It failed miserably. So we regrouped and said, okay, we're going to have to take a deep breath. It's going to be a couple quarters of pain, but we got to put this model together. And after we practiced negotiating, because we would get the team together and figure out how we're going to negotiate, we could literally go into, again, Pfizer, and they say, well, why should I pay you 1.2%, whatever the number might be, or 0.7 or 9%. And we'd say, well, because, 33% of your line is refrigerated, 10% is controlled, the rest is ambient. These cost X more than this. You ship into hospitals and retail, so your coverage and number of ship to locations is this much. Your average line extension is this. The amount of returns that we process are X, and this is what it's going to cost you. And so we could literally walk them through why the fee was better than what it would cost them to do themselves. And many of them, as you can imagine, some said, yeah, that makes a lot of sense. And there was some negotiation, but they agreed. And the other one said no and fought it for a while and went and hired a McKinsey or somebody to do the research. But then they always came back and said, well, yeah, we don't necessarily maybe love it, but actually we think your number's okay and fair, because they did the work and they knew that what we had done was right. So I think that was important. So being able to tell a customer why you're charging something is always critical. And we were able to get the facts. I think the other unique thing that we did early on, which was a good pivot, was imagine when your whole history for 50 years or more is spec buying and hiding product from pharma manufacturers. Like you're trying to buy as much as you can before a price increase and then make money on it. And then all of a sudden you look at them and say, I'm not going to do that anymore. Well, they're going to say, well, how do I know? How do I trust that you're not going to do that? And I said, well, I just negotiated a fee for service agreement with you. And I told you the 1.8% is a fair number. Though, well, how do I know you're not going to take the fee and still spec buy? And I said, okay, we'll do two things. That'll make it work. And I think these were critical to the success. One is we'll give you complete visibility. We will send you the reports that show you our inventory on hand, so you'll always know what we have. And second of all, if you do have a price increase, we will give you a credit for any income we make on our standing inventory. So if we spec buy, it's zero advantage to us because I've got to give you a credit. I'm carrying the inventory, but I'm giving you a credit. So there would be no reason for me to spec buy, and you would get a credit. Those two things made manufacturers go, oh, okay, well, with that, I've got transparency. You're being honest. The 1.8 is truly the 1.8. That's all you're making because you're giving me a credit against that for any inflation I have. And so manufacturers really bought into the way the agreements were written. And we also were willing to stand up to committing to service levels and committing to getting them the data in a way and all those types of things. And so it became, instead of a more adversarial type of relationship when you're kind of buying ahead and hiding, to complete partnership with what's data can help you. How can we help you drive volume? How can we help you manage, all those types of things, to a transparent relationship. And so here's the results. When 2005 was all buy and hold and cash discount, today, and within a couple of years after, let's say 2007, 2008, it's now essentially 100% fee for service and still cash discount. But the margins are 20% higher than they were pre that, and the inventories are 60% less. it really dramatically increased the return on capital. And so while margins are low for the distributors, their capital efficiency, particularly on drug distribution, is off the charts because of this whole change to fee-for-service model.
Got it. It's so interesting. I find this to be such an interesting example for a few reasons. But just at the beginning, you had this situation where there wasn't transparency and there wasn't a real partnership between the distributors and the pharma customers. Mm-hmm. And that led to a situation that was sort of a crisis. The SEC got involved. There was a lot of confusion. Stock prices went way down. And then, as you said, I think a lot of people's instincts would have been just sort of get to some answer immediately. Like, we just have to fix it immediately because we're in a crisis, we're in panic. Right. And what you did, I think, is so interesting and such a good lesson in leadership, which is, let's all take a breath and let's do the analysis, and let's, through transparency and conversations with our customers, get to an answer that's sustainable.
Yep.
And as you said, the proof is the margins and the return on capital in the last 20 years, which is actually better when you work together and you're transparent and you share data. The last thing I find so interesting is, I think a lot of people would go into a negotiation like that and just think about the economics. But there are other non-economic factors that are so valuable both to customers and to you. And so by really being transparent and partnering in that way, you're able just to get great results over decades for the ecosystem.
Yeah. And it's also interesting. One of my fondest memories about that is the negotiations were horrendously tough, right? And you going in multiple times and convincing folks, and then them having to go do some homework to come back to realize you were right and that what you were really offering was a good deal, and working through it. But I think back to some of my best friends are some of the people that sat on the other side of the table and I negotiated with, and we became friends because we were honest and transparent with each other. I think sometimes people use the approach was, well, you just need to pay us. Well, that's not a very good thing. I'm like, guys, my problem is not your problem. I'm not trying to make my problem yours. Things change. I get it. But I am trying to get paid for my value. Here's all the things we do for you, and we should get paid for those. We have to both realize we need each other. You need us to do these things, and we need you to pay us a fair market rate for that. And so having those honest and direct conversations, being armed with facts, and even though the negotiations were tough, some of those people I negotiated with 20 years ago, even the ones that are retired, we're still friends because they remember the tough but fair and honest and authentic and transparent conversations that we had.
It's great to hear. And again, it's sort of a testament to when you're honest, when you're transparent, when you're fair, people notice. And it leads not only to great business partnerships, but friendships too. And maybe along those lines, you have been a leader at one of the most important healthcare companies in the US and the world for a long time. For someone who's just starting out as the leader of a segment or a company, particularly in healthcare, what are the most important qualities that you think they need to be successful?
Yeah, it's a great question. There's a few. I think, first of all, as a leader, particularly as you grow in your career, you need to focus on putting the absolute best team together. Because no one person, no matter how smart you are, is going to be able to run a company the size of Cardinal or do even sub jobs within there. It's just big and there's a lot of challenges. And to be the best possible that you can, you have to surround yourself with team. And I don't think some people are as purposeful about that. So really constantly assess your team. Where are they complementary to you? Where are they not complementary to you? Where do they have skill sets that you really need, or were you missing skill sets for different folks? Really being purposeful about building a team. So I think that's one. Any great leader builds a great team and becomes, I wouldn't say dispensable when, be able to leave and not, lose a beat. But you should have that goal in mind that you could actually go away and disappear and the company can survive and do well without you because you built such a good team and bench around you. I think the second thing would be open dialogue, that you purposely encourage it, demonstrate it, and when people do it in front of you, call them out and thank them so other people see it's okay to disagree with you and have open dialogue. It's so complicated in today's world. Things move so fast that if you don't have people around you that feel comfortable that they can speak their mind and share their wisdom, you can build a great team. But if you're not listening to them, that's not going to matter. So you need to be able to create that work. I think the other two things are, and I see this as a huge problem today in large companies, is the amount of bureaucracy in large companies is mind-numbing. And it's so hard for big companies to be innovative and to not move slow. I see it all the time. We'll have some great idea, with some of the startups I'm working with, and 19 people will like it and one person won't. And it just gets stalled and dead. And it just, it's just amazing how bureaucracy can kill things. So being ruthless about talking about speed and getting things done and, keeping bureaucracy down. I think you have to constantly think about that and talk about that, because if you don't, it just naturally creeps in on big companies. And then lastly, I would say you have to find time to focus on strategy. When you're in large jobs, whether it's CEO or levels down below, your day-to-day responsibilities are overwhelming at times. If you're a high performer, you're incredibly busy. You always have a lot on your plate. So you constantly could work 12, 15 hours a day, every day on just stuff in front of you. But you purposefully need to say, I am going to set aside a certain amount of time to free think, to spend time with individuals different than me, and think about strategy. What can I do differently in the company? What can the company do differently? What are the things going on externally that are going to shape your business? And if you're not purposeful about spending time on strategy, it just slips away. And then you find yourself, behind your competition.
It's so interesting. And, I'm reminded of an interview I saw, I believe, with both Bill Gates and Warren Buffett. And Bill Gates was answering the question, what has he learned from Warren Buffett about being a business person and CEO? And he said what he learned was that the busyness of his calendar isn't an indication of his seriousness as a CEO. Mm-hmm. I always thought that was so interesting that exactly as you say, we're all so busy. We all get caught up in the day to day, but being able to take a step back and actually think about strategy and actually think about where you're going and not just the next 6 or 12 or 18 hours is just so important. One final question I wanted to ask you. Some people watching or listening to this podcast will be just coming out of school, embarking on a career in healthcare. What advice would you give, whether it's qualities to focus on, roles to take for someone who one day wants to lead a great healthcare company?
Yeah, gosh, that could be an incredibly long list, because there's a lot of things that are important, right? I always spoke about, 3 things were always really important to me: speed, grit, and getting lost in the team. Speed is the willingness to, get after stuff and get on it. Things are changing so fast. Even in today with AI and tech, it's changing so fast. If you are a person that has analysis paralysis and can't make decisions and can't get things done, it's really hard to be an effective leader in today's world without having some speed. Now, you got to be careful you're not careless, because some, I was fast. Well, okay, yeah, but you weren't informed fast. You were just careless. There's a difference there, but you got to do your homework, but then make a decision and move. Speed is really, really important, I think, as you get up in the company. I think the ability to build a team and maintain and keep a team, obviously that's important. And people want to work for, people leave companies a lot of times mostly because of their boss, not because necessarily of the company. And so are you the right type of boss that is understanding, caring, bringing opportunities to your team, listening to them, doing all of those things, I think are incredibly important. And I mentioned grit. Stuff is hard. I can tell you how many times on Red Oak or Fee for Service and COVID, up all night, 24/7, trying to figure out something and hitting roadblocks. And I remember one time on Red Oak, somebody looked at me and said, "We're never going to get this done." And I said, "No, we will." And how are you so confident? We're pounding our head against the wall. We're in different places. I said, because it's good for them. It's good for us. We both know that. And we're both going to figure it out. We will figure it out. So I think, having the grit to stick to something, I think, Angela Duckworth's work on grit and the book on that, it's a really important book to read. I think grit's really important. And then I also said about getting lost in the team. There's a lot of people that have made their careers as individual contributors or maybe don't feel much like team players. But to me, that's so important that at the end of the day, you care more about the team winning than you do your own personal stats. And I think within companies, way that plays out is, you have your budget and your stuff in your area. And sometimes you might have to spend $1 million for another, department to make 10 million. Well, some people actually won't do it because it hurts their own budget, right? They can't get lost in the teams. And I think you need the trust to say, no, the company's going to take care of me. They're going to understand I made this decision because I know it's the best for the company, and let's inform everybody and get after it. So I think being creative around how you do that, I think those are all some important characteristics, but authenticity, all those things, those are important, but those are a few things that come to my mind.
Mike, thank you so much for joining me today. I really appreciate it. It's always a pleasure.
It's been great to be here. And I hope some of these stories, comments, insights are helpful to you and others that listen to this, but it's been a real pleasure on my part too.
As we wrap this episode, I'm joined by my colleague Vicente Piedrahita, Managing Director in the Strategic Resource Group at THL. Vicente, one thing that really came through in my conversation with Mike, and it might seem really obvious, but it's so important, is just that effective leadership really matters and can really make a difference. You've spent so much time with CEOs of healthcare companies. What are some of the key qualities that you found are really important in making a great leader at a healthcare organization?
It's a good question, John. I think a lot of the factors that make a great leader regardless of the type of organization. And then I'll talk a little bit about some of the healthcare specific pieces I've seen. But just being a great leader of people, being relentless about getting the right talent under them, top grading, being able to set a strategy and vision for the organization, being sufficiently on top of the details. A lot of things that I think you'll find everywhere. When I think about a healthcare context specifically, I'd probably highlight two related pieces. One, being mission aligned from the top is really critical, I think particularly with provider businesses, but everywhere in healthcare. The work that we do in healthcare makes people's lives better, makes their health better, can save lives in some situations. So that is one piece. A great healthcare leader will have that from the top. I think related to that is a pretty relentless focus on quality. I think the best leaders in healthcare blend the focus on quality with an emphasis on how do we do this better so that we can do it more efficiently and do more of it.
Vicente, one other thing that I thought was really interesting from the conversation with Mike was how he laid out just some of the key challenges of being a leader of a healthcare company during a crisis like COVID. And I've always found the concept fascinating of a wartime versus a peacetime CEO. I know Ben Horowitz has spoken about that and written about that. What are some of the key ways that you've seen a CEO of a healthcare company can step up in really difficult situations?
I thought Mike highlighted some really good observations. Staying calm and projecting confidence even with uncertainty. People are going to be looking to you. And so I think that is critical. At the same time, being authentic and admitting what you don't know. It's confidence, it's not hubris. Very transparent and consistent communication. And then I thought that the humility of trying to surround yourself with as many good sources of expertise as you can, because you're trying to make decisions in a challenging and uncertain environment. I thought those were all really good points. I'd highlight a couple of others that I think we've lived through. It's a bit of a cliche, but hope is not a strategy. And when you talk about the peacetime and wartime, I think one key differentiation is, do you just kind of hope that it gets better, or do you proactively seek to act? And then the last piece related to that, or trying to inform those, I think is about getting really sharp on the metrics of the business and trying to shine a light as much as possible on what's going on. Some of the companies that we've had that have the best operating metrics and the best visibility into everything that's going on in the business have been through a crisis. And in those situations, we've worked with the management team to build really, really good visibility so that you can manage through that. I think that's a huge advantage when you're trying to manage through a crisis.
And finally, Vicente, one thing I've found interacting with great CEOs and great leaders is that they are always looking to get better themselves and they're always looking for partnerships for teams that make them better. At THL, you and the SRG group partner with CEOs all the time. How are we able to partner with them to allow them to work at the top of their game?
Thanks for the question, John. I think it starts first and foremost with alignment. We believe alignment is absolutely critical. We start before we make any investment, we work to align with the leadership team on how do we see the value creation opportunities in this next phase of growth? Is that aligned with how you think about it? Where do we have capabilities that can be complementary to what you have? And we seek to always maintain that alignment, even as circumstances change. We roll up our sleeves and help. So the leadership teams will be facing challenges over the time that we're partnered. We want to ensure that we help you remove the barriers and we help you work through the challenges, build the scalable organizations that are going to enable you to drive the mission that we were talking about earlier, bring it to more people. We're pretty focused. We have specific areas of functional expertise that we're deep in and that we've geared towards the types of companies that we invest behind to bring kind of repeatable support that we can help with. Because ultimately the leadership teams are the ones who really know the industry in tremendous depth and are building the business and growing the business. Because of that, I learn a ton every time I get to work with a new team. It is, just as you say, the best folks are looking to learn and improve themselves. We're in the same boat. We don't have everything figured out. We want to learn from the teams that we partner with as much as we want to bring specific capabilities to the table and help them.
Vicente, thank you so much for joining me today. Really appreciate your thoughts as always, and I look forward to continuing the conversation very soon.
Thanks for having me on, John.
Thank you for listening to Healthcare in Action, brought to you by THL. To help Healthcare in Action reach more listeners like you, either share this episode with a colleague, subscribe to the show, or rate or review us on Apple Podcasts. And for more background on THL's healthcare vertical, visit thl.com/verticals/healthcare.